More than 40 years ago, in the middle of Roxbury, the former Beth Israel Hospital helped open and staff one of the nation's first community health centers. Beth Israel Deaconess Medical Center's belief in community-based care continues through partnership with our 7 affiliated health centers. And the mission remains to care for individuals, families, and communities. Community health centers provide excellent care right where people live and are bridge to services at Beth Israel Deaconess Medical Center whenever necessary.
Southfield Community Health Center has its doors open to everyone, but we particularly cater to the underserved immigrant Asian population of Greater Boston. Patients, for the most part, have come from places where preventative health has not been stressed. And so trying to get that message out to the community that this is not just a place to come when you're sick, but a place to come to maintain your health and prevent disease.
A little bit of compression, okay? Not too much.
Yes. Cancer is the one disease that beats heart disease as the #1 reason for death for women in the Asian population.
Hold your breath.
So for us, it is a priority to screen for breast cancer and cervical cancer. And the fact that we now have on-site mammography has increased our mammography screening rates dramatically.
Well done.
Okay. Thank you very
You're
much.
welcome. Good job.
After a patient receives a diagnosis of an abnormal mammogram or breast cancer at our health center, they get referred to Beth Israel Deaconess Medical Center. And we're fortunate to have a Chinese-speaking cancer navigator accompany the patient to her appointments.
同埋咧有個護士咧，即係一直會係跟進住你咯。
Patients are more apt to now go to their referrals at Beth Israel because we have Christina Ho and interpreter service to help them navigate this more complicated system.
The doctor said I have the cancer, breast cancer. That makes me really, really sad. I don't know how to do. This program is just excellent, just saved my life. So I very thank you. I appreciate this program and your wonderful job.
Anecdotally, it seems that many of our breast cancers in the patients that we've diagnosed are early stage, and so we're hopeful that it really has made a huge difference.
即係好多詳細嘅慢慢翻去睇咯。
Community health centers provide tailored care for their patients, many of whom are marginalized or disenfranchised.
So I work for the BIDMC Health Center. If you need help, if you have questions, if you want to get tested for any STDs, STIs, you can go there.
The Sidney Borum Health Center is in downtown Boston, right across from the Boston Common. We see young adults from ages 12 to 29, mostly focused on street-identified youth, homeless kids, high-risk adolescents and young adults. We care for individuals because we can't simply smear them as a group. The homeless kids, the transgender kids. If we approached our patient population with that universal typecast, we wouldn't succeed because these youth come in with complicated histories. We have outreach workers and they actually go out on the streets and talk to kids in the locations of where they know high-risk adolescents and young adults hang out. They have very little trust or confidence in adults or in social institutions. Part of what we have to do is find a way to recreate a sense of confidence and trust between that population and us. The goal is over time, they actually will be comfortable coming to the clinic where I can provide more comprehensive services. And through that, then also get them into the Beth Israel, where we refer for specialist care. Through my connection to Beth Israel, my youth patients can get the best care, bar none, in the world. I think that's pretty miraculous. Because our goal is to keep them alive and healthy long enough that we get them into adulthood, and then by the time they're adults, they know how to use the healthcare system. So we see ourselves almost as training wheels to a certain degree. We teach them how to utilize healthcare.
Community health centers offer comprehensive health and human services, a sort of one-stop shopping for families.
Dimock was started in the 1800s as the New England Hospital for Women and Children. In the late 60s, it became a community health center, really in response to the needs of the community. We serve a primarily African American community as well as a Latino community, and the patients and clients that we serve come from our surrounding areas, which include Roxbury, Jamaica Plain, Mattapan, and Dorchester. Hey, your blood pressure is beautiful, it's 110/60. We really do try and focus on generations of care, in that when a family walks in the door, there's a service that's available to everyone. And not only do we focus on health, but we also focus on other areas that are called social services like behavioral health, child and family, where we have Head Start and early Head Start programs on campus. So it's a very broad approach and a very comprehensive approach to those in need.
She sounds great today.
Yeah.
Our OBGYN providers are on staff at Beth Israel, and we do all of our deliveries at Beth Israel. And once they've undergone their delivery, they would then be referred back to the Community Health Center for all of their postnatal care, as well as the pediatric clinic. So it's a very nice continuum of services. I've had patients who are the grandmothers, and then they bring their daughters in, and then the daughters bring their children in, and they grow up knowing Dimock and being a part of the Dimock family. So we really do focus on the family, educating the family, providing health and welfare to the family, and then hoping that the changes that we make in an individual's life will be passed on throughout the generations.
BIDMC shares a commitment with its community partners to provide equal access and respectful care to all our culturally diverse families.
The Joseph Smith Community Health Center has been around for 36 years, and our mission is to improve the health and well-being of the communities of Allston, Brighton, and Waltham. Our strength compared to other community health centers is our families are much more diverse culturally and racially than many other communities. I think for the health center, providing culturally sensitive care means a lot of things. So right when you come into the door, all of our signage is in multiple languages. And as much as possible, we try to employ staff at the health center who are bicultural and bilingual,
Okay.
and who themselves have often immigrated to the U.S. and therefore truly can understand what that patient is facing.
Penicilina
Okay.
y Albactrin.
Okay.
The health center has been affiliated with BIDMC for over 10 years now. We share a value that our insured and uninsured patients receive the same care.
Hola, doctora Isma, ¿cómo está usted? Estoy bien, ¿y usted?
And then BID has been wonderful in providing interpreting support.
โอเคค่ะ งั้นพรุ่งนี้บ่ายโมง15 นะ
There is a seamless transition so that when the patient arrives at the hospital, somebody's going to be there to be able to speak to them in their primary language, and the patient's going to feel comfortable and be able to fully participate in that visit.
Okay.
It's a commitment that they told us that they would make, and they have kept good on that commitment.
BIDMC provides clinical expertise and support to help communities meet their particular needs.
Cape Health Services has over 40-year history of serving people in whatever it takes modality. On a year-round basis, I think our real value is as a primary care provider.
All right, any problems or questions or concerns?
We offer urgent care year-round, but in the summer, we have as much as a tenfold increase in population. We'll see 3,000 or 4,000 patient visits in a month, and about half of those visits are more walk-in urgent care. The emergency medicine trained physicians from Beth Israel have had such a wonderful partnership with us. Our patients can actually be seen by those same emergency room physicians from Beth Israel in Provincetown 7 days a week from 5 o'clock to 9 o'clock.
Hi, I'm Dr. Kennedy. I'm the urgent care doctor today. During the summertime, because of the extra need for staffing here in Provincetown, the emergency physicians in Boston provide extra coverage during the evening hours. Well, why don't we get an x-ray to see if the bones are broken or if there are any abnormalities?
I would say it has definitely saved lives. It has definitely enabled people to have more prompt and therefore better outcome care.
Yeah, if you can hold that position for me.
And it's just wonderful knowing that we have a partner who honestly cares about the populations we serve.
Community health centers address public health concerns that are specific to the communities they serve.
This is Baldwin Street Health Center. We have a large community of Hispanics, Cape Verdeans, African Americans, and Caribbean patients. And in general, incidence of diabetes higher in this sort of population. And I personally have a large number of diabetic patients. For the past 3 or 4 years, we create this diabetes group session. I believe that to better treat a patient, you need to know the patient well. So it's a comprehensive care during this session. We go over all their medications, ask questions about everything. We do make sure they are well interconnected with our staff here and also with our specialty service at Deaconess Medical Center. And we notice for these patients in the group, their diabetes data, the measurements are much better than patients not in a group. We were able to provide better comprehensive care at the multidisciplinary level for all these patients. They have a sense that they will accomplish what we've been teaching them, that is to minimize the complications of diabetes in the long term.
Community Health Center expertise creates opportunities for research synergy and knowledge sharing, ensuring better health outcomes for targeted populations.
This is Fenway Community Health Center. It was founded in 1971 here in Boston. We serve anyone who walks across our threshold. And then we have a special identity because we serve the community that's represented by the LGBT individuals in New England.
Hold the typhus for me.
Much of that really came from our experience in the early part of the AIDS epidemic here in Boston. In fact, today we're the largest provider of outpatient HIV services in New England. We do a lot of HIV prevention research, everything from microbicides, vaccines, and the development of approaches to use medications that we use to treat HIV. And we, a few years ago, actually became the first population research center in the United States, funded by the NIH, to look specifically at the LGBT community and the health of the community using various techniques in survey research.
Hello, my name is Sochek, calling from the Fenway Institute. I'm calling in regards to the HIV vaccine study.
Beth Israel Deaconess Medical Center at the very beginning of Fenway's existence really played a very active role in helping to foster the work that we were about. The medical center had really stepped up to recognize that there were unique needs for the LGBT community that Fenway could uniquely address, and that we could work together on that in partnership. Beth Israel Deaconess played a very early and leading role in helping to guide how hospital care should look in terms of the health needs of the LGBT community.
Beth Israel and New England Deaconess Hospitals were founded by people who wanted to assure that members of disadvantaged communities had access to the kind of care that we would each want our family members to receive. For over 40 years, our hospitals have worked closely with community-based health centers and have led the way in community-based care. Now, as we face healthcare reform moving forward, alliances that we've formed and the community network we've developed becomes even more important to our mission of providing absolutely terrific care to every patient efficiently and effectively. BIDMC is extremely well positioned to thrive in that environment because of our alliance with our community health center colleagues. Together, we can provide the right care to the right patient at the right time in the right setting.